So today we're talking about harm minimisation and primary prevention in the context of CDATs, and trying to get a better understanding of how we can work within that framework. And we're really privileged to have Ange Matheson from New South Wales Health to tell us all about how those fit into the activities of CDAT. So welcome, Ange. Thanks very much for making the time to come and talk to us.
Great to talk to you, Dennis.
Yeah. And can you start by telling us a little bit about your role, what you do, and how principles of harm minimisation and primary prevention, etc., fit into the work that you do with New South Wales Health?
Sure. So I'm the Manager of Harm Reduction at New South Wales Ministry of Health. So I'm based in the Centre for Alcohol and Other Drugs. So my work encompasses, as you might have guessed, harm reduction, but also there's elements of prevention work and early intervention work that also fits within my portfolio. So the span of my work goes from, at one end of the spectrum is the take-home naloxone program. That's a program we're rolling out across government and non-government services that assists people to reverse an opioid overdose if and when it happens. At the kind of other end of the spectrum, my work also encompasses some prevention and early intervention work, and so that's where we have programs like the Community Drug Action Teams program and the Life Education program sitting all within my portfolio. Also within the same centre, we have a manager for early intervention and prevention. Her name's Lisa Russell, and she also has some input into the Community Drug Action Teams program from a New South Wales Health perspective.
Okay, great. And the work that New South Wales Health does in all of those areas is covered by the National Drug Strategy. It all comes under the overarching principles of the National Drug Strategy. Could you tell us a little bit more about what that is and what it aims to achieve?
The National Drug Strategy is the broadest guiding document. It guides all of the work that we do at the Centre for Alcohol and Other Drugs, as well as everything that we fund other services and agencies to do across New South Wales. So the National Drug Strategy it's got a long history. It's been in place in Australia since 1985. And it brings together a whole lot of different areas of expertise, and it aims to provide a coordinated national approach to addressing drug and alcohol availability, use and issues, and it's all about being a partnership between some really diverse agencies. So there's roles that customs and law enforcement play. A lot of that is around the supply reduction element of harm minimisation. So minimising the amount of drugs that come into Australia in an uncontrolled way, and also controlling the availability of some substances, things like alcohol. Let me see, also the health element of the National Drug Strategy. That looks more at the demand reduction side of things. Demand reduction is kind of diverse. It incorporates both prevention, so looking at how you prevent alcohol and other drug use from commencing, or how to delay the onset, through to things like treatment, so offering evidence-based ways and really accessible ways for people to seek treatment so that they can stop using alcohol and other drugs or manage their use better. Through to the harm reduction side of things, and a lot of that incorporates really engaged community agencies and community activists who are really well informed to be able to assist with creating safer environments and also empowering people to make better decisions that are going to reduce the harms for themselves. So it's quite diverse. There's a role for everyone to play, and we all just need to be essentially working together to achieve the same overall goal, which is minimising harms from alcohol and other drugs in Australia.
And the CDATs, of course, have an important part to play in that area. So could you be a little bit more specific in terms of how CDATs could contribute and how they do contribute in achieving the goals of the National Drug Strategy?
Sure. I mean, CDATs actually have roles to play, surprisingly, across all three elements of harm minimisation. So there's some work that increasingly we're encouraging CDATs to get involved with, which is about engaging with liquor licensing processes. And ultimately, that's a supply reduction measure. So it's about communities recognising when availability of alcohol is problematic in their area and engaging with the licensing process to potentially reduce the availability of alcohol as a result, getting outcomes such as reduced trading hours for a licensed premises. That's a supply reduction measure that CDATs can have a real role in, and it can be really, really effective. Through to there's harm reduction work that CDATs can do, so educating people about how to create safer environments and keep themselves safe. But a lot of what we think that CDATs are really well placed to do is in the prevention space. So CDATs are really uniquely placed. They're right in their local communities. So when we think about the kinds of people we would like to be talking to about not commencing drug and alcohol use or about delaying their involvement with drug and alcohol use, these are not people who are coming into treatment services run by government or non-government services. They're in their local communities. They have trusted relationships and engagements with others in their local communities. CDATs are also in those spaces, and so we think that they are just really well placed to be talking to those groups of people in ways that perhaps New South Wales Health can't. So that's a really strong role, I think, that CDATs can be playing.
Fabulous. And how can CDATs be guided better to ensure that they work within those particular guidelines of the National Drug Strategy? What tools are available to help them keep on track, basically?
So I think we all know that drug and alcohol issues can be really, really complex and emotive, and it can be difficult to know where to start. So it's really, really important to be relying upon the evidence. And there's a lot of evidence that's been gathered over the years by research agencies, by community groups and community organisations, conducting their own research and partnering with research agencies to kind of build up that evidence base. So we would say that in the first instance, CDATs can rely upon the documents that have been created specifically for the Community Drug Action Team program. So there's things like the Framework for Action. There's a really good new evidence-informed guideline that we would say is a really good go-to. So once CDATs have identified an issue in their local area, if they want to know where to start, look to the evidence-informed guideline first, and it'll give some really good ideas on what's been tried and what we know works. We have limited resources and time, and so I think everyone wants to be doing work that they know is going to work. So we would say start there, and also talk to your community development officer, because that's part of their role as well, to support CDATs to identify the best, most evidence-informed approach and how to go about it. And also, another important part to that is that we're really encouraging CDATs to evaluate the activities that they conduct, because in that way they can actually check that what they are doing is having the desired effect. Are community members learning more about alcohol and other drugs? Do they know where to get help? And are they able to decide to change something on the basis of what they've learnt from CDATs? So this is a great opportunity. CDATs can actually be contributing to that evidence-based so that, future teams can build further on that and know what they're doing is effective.
Fabulous. Standing on the shoulders of giants.
Yes, indeed.
Great. And we'll be putting links to the documents that Ange just mentioned in the description for this video. Well, Ange, look, thank you very much for coming and talking to us. It's been really helpful, really informative. And thanks again very much for your time.
Thanks, Dennis. My pleasure.
Okay.